Hello, my name is Eric Bertrand and today I am talking about liraglutide in children and adolescents with type 2 diabetes. Summary. The incidence of type 2 diabetes in children and adolescents is rising, with the increase driven by childhood obesity. And type 2 diabetes disproportionately affects disadvantaged minorities.
Well, diabetes in itself is a relative lack of insulin, either because we can't make it, which is type 1 diabetes, what used to be called juvenile diabetes, or if we're not responding very well to it, which is type 2 diabetes, what used to be known as adult type diabetes. We are seeing more of it in children. The reasons are multiple. One is because we are gaining weight quite rapidly as a society. In fact, our school systems now, the Dallas Independent School District at least, have shown that we have about 40% of our kids are at least overweight and 20% are obese. So about half and half overweight, half obese. Overall, in the past 5 years or so, we have seen a remarkable rise in type 2 diabetes diagnosed around our center. So where we used to maybe diagnose 1 or 2 patients a year, we are diagnosing around 20% of the kids with new onset diabetes with type 2, which is very concerning to all of us. So what to look for in kids is very difficult to define. 50% will have no signs or symptoms whatsoever. In the kids that I see in this, what's now called the Coach Clinic, the Center for Obesity and its Consequences in Health, most of them have absolutely no symptoms whatsoever. And that's pretty typical for type 2 diabetes. It takes a long time for symptoms to start to come forth and for people to actually recognize them. Now, the 5 risk factors that we look for and we ask our primary care physicians to look for are obesity, family history. About 80% or so of kids will have at least a primary or second degree relative who has diabetes as well. More often in girls, at least in this age group, acanthosis, and their ethnicity. So African American, Hispanic, American Indian, Pacific Islander, all those peoples tend to have a higher risk of developing type 2. The primary thrust has been early prevention, and it always has been. So back about 3 years ago, we started an insulin resistance clinic, which was designed to look at kids with obesity and a skin finding called acanthosis to give them glucose tolerance tests and find out if they actually had diabetes, if they had pre-diabetes, which is just kind of the initial phase before diabetes erupts, or if they are just simply insulin resistant. So in that clinic, we have seen around 400 patients in the past year. Not only are we worried about type 2 diabetes in these children, but also high blood pressure, high lipid values, high cholesterol, depression, bony problems like dislocated joints, dislocated hips, and liver disease. There is a set pathway that type 2 diabetes goes through. The first is this insulin resistance, where our body gains weight and we're not able to use insulin. The second is pre-diabetes, which is where blood sugars start to go up a little bit and our ability to make insulin starts to fall a little bit. And then there's diabetes itself, which is where insulin levels, our ability to make that hormone, just drops tremendously and our blood sugars start to shoot up. The treatment for that, all 3 of those initially is diet and exercise. So we have our dietitian see our kids and I discuss exercise. So 60 minutes of exercise a day will at least improve a child's ability to use insulin, so their insulin sensitivity improves, and it also reduces weight to some extent, and so their blood sugars are a little bit better controlled. I think the last CDC showed that the obesity trends seem to be leveling off, which is good. I don't think it's great. I think a great trend would be to be reducing obesity, and that's what we're working for. I think the use of surgery and diet and exercise and getting the community involved in diet and exercise, including schools, is going to be the only way out of the pit of diabetes that we're in right now.
Application. The first goal of glycemic control is to lower glycated hemoglobin to less than 2 percentage points. Monitor the concentration of serum cholesterol, HDL, LDL, and triglycerides.
The rate of type 2 diabetes in children is skyrocketing, forcing researchers to quickly find new ways to treat the disease. Eyewitness News reporter Jeremy Baker shows us how a drug already on the market for adults could help these kids.
16-year-old Jonathan Moya and 15-year-old Alice Palafos both have type 2 diabetes. Jonathan was diagnosed about half a year ago.
I don't know why, but I was just laughing because I kind of felt like I didn't want to believe it.
Alice was diagnosed 5 years ago when she was 10. Her mother, Janie, says she and her husband, Louis, were shocked.
It was a surprise for us, but it's something that we had to deal with.
They've both had to make changes to their diet and exercise.
Now, since I have diabetes, I kind of feel like it's a good thing because now I have to, it teaches me I need to be more healthy about myself.
We used to eat non-healthy, but now we eat a lot healthier for her and for us.
There are two examples of a rising rate of type 2 in children and young adults.
It's very scary because the complications and the progression of diabetes is different than you would see in their parents.
In the U.S., more than 30 million people are living with diabetes, and more than 200,000 of those younger than 20 years old are living with diagnosed diabetes. Now, between the years 2002 and 2012, newly diagnosed type 1 diabetes in youth increased by close to 2%, but the rate of newly diagnosed type 2 diabetes increased close to 5%, and in kids, the disease progresses much faster. Right now, only 2 drugs are approved for children, but after a 1-year study in which Alice participated, using the drug Liraglutide, which is already approved for adults, researchers are hoping to get the medication in the pipeline for kids.
It's only really been about 20 or 30 years since we've recognized type 2 in kids.
With FDA approval, the drug could be available within the next year. Jeremy Baker, KENS 5 Eyewitness News.
Pros and cons. Metformin is the regulatory approved treatment of choice for young people with type 2 diabetes in the early stage of the disease. However, an early loss of glycemic control has been observed with metformin monotherapy.
Children and teenagers who are diagnosed with type 2 diabetes are often scared about how it will affect their lives. Diabetes is more common than you think, and many people your age may be experiencing the same concerns. Believe it or not, many famous people like movie stars, singers, Olympians, and national leaders have diabetes too. Diabetes did not prevent them from being what they wanted to be, and it doesn't have to stop you. You can live healthy, happy lives by following some steps to change your lifestyle. This video will help you learn how you, your family, and your healthcare team can work together to take care of your diabetes.
Problem applied in Ecuador. In Ecuador, 0.2% of the population between 10 and 19 years of age has diabetes, according to the National Health and Nutrition Survey of Ecuador. Metformin is used as a drug of first choice, since it reduces the macrovascular complication of the disease. Conclusion. In children and adolescents with type 2 diabetes, Liraglutide at a dose of up to 1.8 mg per day, added to metformin with or without basal insulin, was effective in improving glycemic control for 52 weeks.